Diabetes. Diabetes is a chronic medical condition that affects how your body metabolizes glucose, a type of sugar that serves as the main source of energy. When you have diabetes, your body either generates insufficient insulin or uses the insulin it does make inefficiently. The pancreas secretes the hormone insulin, which aids in controlling blood sugar levels. The three primary kinds of diabetes are as follows. Type 1 diabetes. This condition develops when the immune system erroneously targets and kills the pancreatic cells that make insulin. The body thus produces little to no insulin. Although it can happen at any age, type 1 diabetes commonly manifests in childhood or adolescent. Insulin injections or an insulin pump are necessary for people with type 1 diabetes to control their blood sugar levels. The majority of cases of diabetes are type 2 diabetes, which is also the most prevalent type. As obesity rates rise, more children and adolescents are being diagnosed with it, even though it typically develops in adults. The body either doesn't produce enough insulin or develops a resistance to its effects in type 2 diabetes. This form of diabetes is frequently controlled via dietary and lifestyle changes, regular exercise, and, occasionally, the use of oral medications or insulin. Gestational diabetes. This form of diabetes affects between 2 and 10% of pregnant women and develops during pregnancy. It appears when hormonal changes compromise the body's capacity to adequately utilize insulin. Most pregnant women with gestational diabetes can regulate their blood sugar levels by making dietary and exercise adjustments. But if untreated, it can be dangerous for both the mother and the child. Frequent urination, excessive thirst, unexplained weight loss, increased hunger, exhaustion, sluggish wound healing, hazy eyesight, and recurrent infections are all typical signs of diabetes. The early stages of type 2 diabetes, however, may not present any symptoms for some individuals. Diabetes can cause major problems, such as heart disease, kidney damage, nerve damage, neuropathy, eye damage, retinopathy, foot ulcers, and a higher risk of infections if it is not well treated. However, many of these consequences can be avoided or postponed with appropriate medical attention, a healthy lifestyle, and blood sugar control. Typically, blood tests that evaluate your blood sugar levels are used to diagnose diabetes. The goal of treatment is to maintain blood sugar levels within a target range using a combination of medication, lifestyle modifications, and routine blood sugar monitoring. The goal of diabetes treatment is to control blood sugar levels and reduce the possibility of complications. The type of diabetes, personal variables, and the severity of the ailment all influence the particular treatment strategy. Here are a few typical therapy options. Lifestyle modifications. For many persons with type 2 diabetes, changing one's way of life is the first step in therapy. Adopting a balanced diet that prioritizes whole grains, fruits, vegetables, lean proteins, and healthy fats is one way to do this. It's crucial to keep your intake of processed and sugary foods under control. Regular exercise, like brisk walking or aerobics, helps to increase insulin sensitivity and glucose regulation. It's also essential to reach and maintain a healthy weight. Medication. Medications may be provided to help control blood sugar levels depending on the type of diabetes. Insulin injections or the use of an insulin pump are always necessary for type 1 diabetes. Metformin, sulfonylureas, meglitinides, thiazolidinediones, and DPP-4 inhibitors are examples of oral drugs that may be administered for type 2 diabetes to increase insulin production, decrease glucose production, or improve insulin sensitivity. In some circumstances, injectable drugs such as SGLT2 inhibitors or GLP-1 receptor agonists may be employed. Insulin therapy. Insulin therapy is usually necessary for people with type 1 diabetes. If oral drugs or other injectable treatments cannot sufficiently manage blood sugar in some cases of type 2 diabetes, insulin may also be required. Blood sugar monitoring is crucial for determining how well a treatment works and making any required corrections. To check blood sugar levels at home, a glucose meter is commonly used. There are also devices for continuous glucose monitoring, CGM, that offer day-long real-time glucose measurements. Support and education. Diabetes management requires adequate education, which is a key component. Understanding diabetes, how to manage it, proper food, exercise, and medication use can enable people to take charge of their health. A platform to share experiences and knowledge and emotional support can be found in diabetes support groups or counseling. To create a personalized treatment plan, it's crucial to collaborate closely with medical specialists like doctors, diabetes educators, nutritionists, and pharmacists. Successful diabetes care requires maintaining a healthy lifestyle, regular checkups, and monitoring blood sugar. I hope this gave you a better understanding of diabetes. Make sure to click subscribe to not miss any upcoming videos. Thanks for watching.